almost every patient who's ever had a wound, it's a scary time. You don't know what's going to happen next week or the next day, and so we want to make sure those patients get into us as soon as they can.
You know, we have people who have a new issue versus people who come to us who've had an issue for years, decades even, and nobody can make them better, and they come to us and we make them better. We treat every single person here as if they were one of our own family. From my bottom of my heart, I mean that. Like, I've worked in a lot of other facilities, and we have something really special here.
In James's video, that's what I think really highlights really well, is just how many people you have to coordinate care with on somebody who's that medically complicated. He's definitely unique given the trauma that occurred. We don't get a ton of patients who are driving 200 miles an hour when they have their accidents, but we get lots of patients who have very significant accidents or events that occur, horrible infections, things like that. I think sometimes for those of us who are healthy, it's hard to imagine what all you need when you have a condition that's lasted years. Their resources are drained. Many of them can't work with their wound. Many of them don't have the insurance support that allows them to have dressings at home or nursing at home. A lot of them don't have access to the long-term support that they need. And so they get to the point where all they need to do is prevent future wounds, and they can't afford the garments that they need to wear.
Custom garments can cost $200 to $300 for a single leg, which is a barrier for a lot of people. If people don't get the therapy and the treatment they need now, then they're gonna have problems in the future as well.
What things can we decrease their barriers, because we have these funds to help give them the best experience and get them in the door. Some people won't even come because they're worried about all those expenses.
So I have a lady today who is going to be graduating from her wound treatment, and I met her over a year and a half ago. Just a complicated diagnosis, complicated history, lovely lady.
The quality of my life has improved because I am not in pain. They find what works with you.
Part of her healing isn't just what I'm doing for her wound, but looking at her as a person, and her issues haven't always been related to her wound, but I've been able to see her through those other issues as well.
We have a big silver bell that everyone rings when they have, come and have officially been discharged, and that is awesome.
She's seen a lot of people come and go and heard that bell rung, so she's really excited that today's her day.
I dreamed about ringing the bell, so the bell is a good point.
Might shed a couple tears, we'll see.